For weeks now, Rhode Island has been preparing its field hospitals and existing hospitals for a surge in people needing intensive care for COVID-19. That meant asking hospitals to postpone non-critical surgeries and procedures. As Eyewitness News reporter Alexander Leslie explains today, Rhode Island hospitals need to submit their plans of how they will safely resume those.
States like Oklahoma and California have allowed these elective procedures again for the last week, and more states will be doing so today. Today, outpatient surgeries in Iowa can resume. Governor Kim Reynolds says it's in part due to not experiencing a surge.
Our ICU beds, vents are well managed and in good supply.
There are new regulations. Patients must have a negative COVID-19 test within 48 hours before surgery, and at least 30% of ICU and surgical beds must be reserved for COVID-19 patients.
If you're a patient who's been inconvenienced, I'm sorry that you've had to wait.
Today, Rhode Island hospitals must submit their plans on how they'll resume non-critical surgeries and procedures, which have been postponed since the early days of the pandemic.
If you're a hospital, this is a key source of revenue.
Leaders at Lifespan and Care New England say they've lost millions in the month of March. In addition to elective surgeries, hospital leaders report fewer emergency room and doctor's visits, all big sources of revenue.
They did the right thing by shutting down these non-critical surgeries and focus on the surge.
The governor says she wants hospitals to take infection control, patient isolation, resources, and more into account.
I don't want anyone to think we're just reopening without a great deal of thought and care and the appropriate equipment.
The governor said you can consider this to be one of the phases of the economy reopening in stages. We expect more details on this and the economy overall in her briefing in the next hour. I'm Alexandra Leslie, Eyewitness News.